Vitamin D3, why does it matter? Most people think vitamin D3 is just about bones, but it's far more than that. Vitamin D3 actually behaves like a hormone. It enters cells and influences the activity of hundreds of genes. This is why vitamin D3 affects so many systems in the body, not just bone strength, but also muscle function, immune regulation, brain health, mood, and metabolism. This is why vitamin D deficiency is linked to falls, infections, fatigue, low mood, and metabolic problems. So, when we talk about vitamin D3, we are really talking about whole body health, not just calcium. This talk was compiled by Dr. Siva Navaratnam and ChatGPT, my educational partner. I would also like to thank my children, Deenan and Jazara, for helping me in the production of this video. Vitamin D3 Key functions. Vitamin D3 has several important functions, and this slide summarizes the key ones. First, vitamin D3 improves calcium absorption from the gut, which is essential for maintaining strong bones and preventing fractures. But just as importantly, vitamin D3 improves muscle strength and balance. This is why adequate vitamin D levels are linked to fewer falls, especially in older adults. Vitamin D3 also plays a regulatory role in the immune system, helping the body respond appropriately to infections while reducing excessive inflammation. There is also growing evidence linking vitamin D3 to mood and brain health, with low levels associated with depression and cognitive decline. Finally, vitamin D3 helps reduce chronic inflammation and improves insulin sensitivity, which connects it directly to metabolic health. So again, vitamin D is not just about bones. It affects muscles, immunity, brain function, and metabolism. Vitamin D3 and cellular aging. Let's talk briefly about cellular aging. At the ends of our chromosomes are structures called telomeres. You can think of them like the plastic tips on shoelaces. They protect genetic material when cells divide. As we age, telomeres gradually shorten. Shortened telomeres are associated with aging and a higher risk of chronic disease. In a large, well-designed Harvard-led study called the VITAL trial, researchers found that people taking vitamin D3 had slower telomere shortening over time. Interestingly, omega-3 supplements did not show the same effect in this study. This does not mean that vitamin D3 stops aging, but it suggests that maintaining adequate vitamin D levels may support healthier aging at the cellular level. Again, this is about supporting health, not reversing aging or replacing other lifestyle factors. Vitamin D3 and COVID outcomes. This slide looks at vitamin D3 and COVID outcomes, and it's important to be very clear and responsible here. Several observational studies found that people with lower vitamin D levels tended to have worse COVID outcomes, including more severe illness. In studies from Egypt and parts of the Middle East, higher vitamin D levels were associated with milder disease. However, this is association, not causation. Vitamin D is not a treatment for COVID and should never be presented as one. What these studies do suggest is that people who are vitamin D deficient may be more vulnerable during infections. So the practical message is about general immune resilience and baseline health, not about treating or preventing COVID specifically. How much vitamin D3 do you need? A common question that is often asked. We looked up the literature, and the result was for many adults, a daily dose of around 1,000 to 2,000 international units is often sufficient to maintain healthy levels. However, if someone is clearly deficient, higher doses may be needed, but this should always be temporary and supervised with follow-up blood tests. We are not treating a number, but aiming for a safe and effective blood level, usually around 75 to 125 nanomoles per liter. What's important to understand is that more is not better. Very high, unsupervised doses, sometimes taken weekly or monthly, can lead to problems with calcium balance and do not appear to provide extra benefit. The key message is test, personalize, use sensible daily dose, and monitor. How to take vitamin D3 properly. This slide is very important because many people take vitamin D3 correctly in dose but incorrectly in practice. First, vitamin D3 is fat soluble, so it should always be taken with a meal that contains fat. Taking it on an empty stomach significantly reduces absorption. Secondly, magnesium is essential. Magnesium is required to convert vitamin D3 into its active hormonal form. If someone is magnesium deficient, vitamin D simply won't work as well. Third, for people taking vitamin D3 long term, vitamin K2 may help guide calcium into bones rather than soft tissue. This is about balance, not excess. Finally, daily dose works better than large weekly or monthly doses. Regular, steady intake leads to more stable blood levels and fewer side effects. So the message is simple. Take vitamin D3 with food. Ensure magnesium intake. Consider K2 if long term, and be consistent rather than excessive. The key take-home messages. So let's summarize the key take-home messages. Vitamin D3 works best when it is personalized. There is no single dose that suits everyone. The most sensible approach is to check blood levels, supplement if needed, and recheck rather than guessing. Consistency matters more than high doses. Regular, moderate dosing works better than excessive or intermittent megadoses. And finally, vitamin D supplementation should always be discussed with your doctor, especially if you have other medical conditions or are taking long-term supplements. Use wisely. Vitamin D3 can support bones, muscles, immunity, brain health, and overall well-being. But like all supplements, it works best as part of a thoughtful, balanced approach. Thank you for watching.